This is Case of the Week 18. My name is Dr. Johnson and I'm a gynaecologist from Southampton. The patient was 48 and premenopausal. She complained of some intermittent right iliac fossa discomfort. Some blood tests had been mainly normal, a normal CA125, normal 19.9 and a slightly raised CEA. This was a transabdominal ultrasound. Transverse view of the right side of the patient here, the uterus in the centre, and the left side of the patient here. Transabdominal view. This is a transvaginal view of the pouch of Douglas, the cervix and the uterus there. This is the pouch of Douglas. And here's a view of the right ovary and the left ovary. This is a video of a transvaginal view of the pouch of Douglas. There's some bowel here. This is the pouch of Douglas. This is a transvaginal view of the right adnexa scanning from right to left toward the uterus. Just looking at a structure. Just look at that again, scanning from right to left, from lateral to medial, through the right adnexa. Transvaginal ultrasound. And looking at that structure in a bit more detail, transvaginal view of the right adnexa. We can see a structure. And you can see where it is on 2D and what it looked like on 3D. What's the diagnosis? Is it ovarian cancer, bowel cancer, a dermoid, pelvic inflammatory disease, or pseudo Myxoma peritonei? Let's look at the images together. This was a transabdominal view, transverse. There's uterus, there's the right side, the left side. Here you can see the right ovary, and here you can see bowel, and this is ascites, which you can see dripping down the lateral aspect of the uterus. There's something very thick that's dripping. In the view of the right adnexa, that was the normal right ovary, and here you can see an appendix floating in this jelly-like ascites. Here it arises from the bowel wall. It was an appendix. There you can see it arises from the bowel wall. And looking at the appendix, there was a structure just at the base of the appendix, a cystic structure, which you could see on 2D and could clearly see on 3D. This was a pseudo Myxoma peritonei. PMP is a slowly progressive disease that produces gelatinous ascites and fibrosis within the abdomen and pelvis. It can be caused by a low-grade appendiceal mucinous neoplasm, as in this patient, or a high-grade mucinous adenocarcinoma. There is often secondary ovarian involvement by the mucinous tumour, but the ovary can be the primary tumour. There can be peritoneal and omental involvement. But symptoms can be non-specific and are often misdiagnosed as irritable bowel or ovarian cancer. More generally, thinking about fluid in the pelvis, always check the pouch of Douglas for the presence of free fluid. If the fluid extends beyond the uterine fundus, it's now known as ascites. When you see ascites, remember to check the serosa and the omentum for tumour deposits. Excessive fluid can be malignant ascites, which is usually anechoic or of low-level echogenicity, and you may be able to see serosal tumour deposits. It can be blood, which is of low-level echogenicity, sometimes with some hyperechoic clot sunk into the pouch of Douglas, which can wobble. Or it can be mucin of mixed echogenicity, a jelly-like consistency, which can also wobble. Thank you.